Covishield, the COVID-19 vaccine, is back in the news again, this time not for the right reasons. Ever since it was reported that multinational pharmaceutical giant AstraZeneca, which makes the vaccine, acknowledged in court documents in the United Kingdom that its COVID vaccine has a serious side effect in the form of blood clots, there have been alarm bells that have been ringing. In India, it triggered concerns among those who have received their doses of the vaccine. Let's now put our focus on one of the cases in India that sparked concerns following AstraZeneca admitting about the rare side effect. In July 2021, Karunya Venugopal, a 20-year-old data science student, died a month after getting vaccinated. After being hospitalized for weeks, she passed away due to a multi-system inflammatory syndrome. Karunya's father claimed that she had developed severe complications 8 days after taking the vaccine and died after a month in spite of 3 weeks of tertiary care hospitalization. Karunya's parents are now planning to sue AstraZeneca for developing the vaccine that killed their daughter. Even as the nation is still fighting the deadly virus with over 740 active COVID cases, and that's according to data from the Union Health Ministry of India. The main question that's haunting everybody's mind is, does India need to continue with the COVID vaccination drive itself? Now, Covishield, manufactured and marketed in India in partnership with the Serum Institute of India, was widely administered in the country to almost 90% of the Indian population, an estimated 175 crore doses. The British-Swedish multinational pharma giant AstraZeneca recently announced the withdrawal of its COVID-19 vaccine on a global scale. The decision came months after the company admitted for the first time in court documents the potential for a rare and dangerous side effect associated with the vaccine that involves blood clotting and a reduced platelet count post-immunization. Apparently, there are about 51 cases lined up in the UK High Court, all pointing fingers at AstraZeneca, claiming their COVID jab caused some serious harm, even death. The victims and grieving relatives have sought damages estimated to be worth up to a whopping £100 million. The rare side effect caused by the vaccine is called thrombosis with Thrombocytopenia Syndrome, or TTS. It was a rare syndrome reported in people who received the COVID-19 vaccine, a vector-based vaccine. The syndrome causes major blood clots combined with a low platelet count, which would lead to a loss of blood flow in a particular region of the body. Blood clots happen in different locations like the brain or the abdomen. The symptoms of the syndrome, which include severe or persistent headaches, blurred vision, shortness of breath, chest pain, leg swelling, or persistent abdominal pain, typically appear 4 to 42 days after getting the vaccination. So, should you worry? Did you know that TTS isn't exclusive to AstraZeneca's vaccine? It's also associated with Johnson & Johnson's Janssen vaccine as well. This connection has been highlighted in previous research reports. Now, mild side effects are relatively common with most vaccines, like temporary fever and pain, but they're short-lived. Medical professionals generally believe that the benefits of the vaccine outweigh their side effects. But here's the big question causing a buzz. Should you worry? To a certain extent, yes. However, there's no cause for alarm as yet. Reported cases of TTS in India have been very limited. Additionally, TTS is an exceptionally rare side effect primarily observed after initial vaccination. So what should be done if developed these rare side effects? We all know that vaccination did emerge as a beacon of hope, demonstrating remarkable effectiveness and safety in curtailing the spread of the COVID-19 virus. However, amidst that success story, a rare but notable concern has emerged called TTS and VITT, or vaccine-induced thrombotic thrombocytopenia. While these adverse effects are exceedingly rare, medical professionals emphasize the importance of awareness and vigilance. What's crucial to understand here is the timing of such occurrences. Symptoms of TTS usually manifest within a few weeks following the vaccination. This underscores the necessity for individuals to remain vigilant and proactive in monitoring their health post-vaccination. Should any symptoms suggestive of TTS arise, seeking immediate medical attention is paramount. Amidst all of this, the Supreme Court of India has now stepped into the picture. The Supreme Court will hear a petition addressing concerns about vaccine side effects, including demands for expert investigation and compensation for affected families. While an early hearing has been ruled out, the petitioners have asked for thorough scrutiny and monitoring of potential risks, emphasizing the need for accountability and support for all those who have been affected. Only 14 sites across India are now conducting COVID-19 vaccination drives, even as the central government of India is yet to pull the plug on the drive. And sources say that there are no clear decisions that have been taken yet on closing down the vaccination drive completely. The recent concerns surrounding Covishield highlight the importance of ongoing vigilance and transparency in the vaccination efforts. While vaccines remain a critical, important cog in the wheel combating the COVID-19 spread, the emergence of rare side effects highlights the need for thorough monitoring and swift response mechanisms. As cases keep coming to light, it's imperative for affected individuals to receive the support and accountability that they deserve.